Hey everyone, how are you today? Thank you for joining me at this podcast. It's another episode of BioNexus Health Podcast series, Autism Uprooted. Today we shall be visiting, actually it's local, right here in New Jersey. It's beautiful, bright, sunny, but blistery cold day here in the United States today. And we shall be speaking with Marcin and Gosia, who are Polish American and parents of little Lena, beautiful little Lena. Little Lena, I mean, she's a big girl now, but Lena came to me about a couple of years ago with a diagnosis of autism spectrum disorder. Sorry, and she has made remarkable gains. I remember that her condominium association was at the time when I first saw her, they were in the process of remediating for mold exposure, water damage. And, but when it involves the associations, etc., it takes time. But during the process, even prior to the actual remediation being completed, she did remarkably well. I think she gained a lot of gains right with the first round of treatment, obviously with the customization. And she stopped using her iPad for communication, started talking words and then sentences by the time we were at the second round of customization of the BioNexus herbal protocol. But anyways, I will let you hear it directly from Marcin and Gosia. They are very proud of their daughter, who is now, she's mostly with me. She's on maintenance now because she's doing really well. She's improved, with her activities of daily living. She's pretty independent, gets herself showered and dressed and makes her breakfast and goes to school. She's doing well in school as well. Academically, she's doing really well. So now allow me to welcome Marcin and Gosia to today's podcast.
Welcome to the BioNexus Health Podcast with Dr. Jodie A. Dashore, who holds a PhD in integrative medicine, is board certified in integrative pediatrics, an internationally recognized pioneering clinician, and author. And now here's your host of BioNexus Health Podcast, Dr. Jodie A. Dashore.
Hey Marcin, hey Gosia, how are you guys today?
Hello.
Hello, good, how are you?
Good, thank you. So cold enough for you in New Jersey?
Yes.
Yes, it is. It's colder in Poland.
Oh, yeah, is it? Okay, yeah. Where in Poland are you guys from? I've been to Warsaw and I have friends in Krakow, but those are the only two places I know.
We used to live an hour and a half away from Warsaw to the east, a small town called Zambrów.
Okay.
It's about 40,000 people population.
Okay.
We still go visit there, but all of my siblings, they moved more east. It calls Białystok.
Okay.
It's a lot more town than Zambrów.
Yeah. I would love to go back. I didn't get enough chance to actually visit the original Baltic area, I guess as ladies, right, for amber and jewelry, and I would love to go visit, but other than the beauty of the area, of course. But I was there for a couple of days, and then I have to travel to Lithuania and Latvia from there for like physician training in BioNexus herbal protocols. So anyways, so that's what we are here for today, to talk a little bit about Lena and how she progressed on the BioNexus herbal protocol. So if I may start with asking you, how did you hear about BioNexus Health, and can you tell us a little bit about Lena's symptoms before she came to see me?
Yeah, we heard about BioNexus Health because I was starting doing a little research because she had a lot of problems like digestive problems, and she wouldn't, like eat right. She wouldn't eat specific foods, and it was very, very painful to, feed her. And then also had a problems going to the bathroom and stuff like that. So we started off by looking.
We started actually with feeding therapy. She was on feeding therapy for about 1 year.
With a holistic doctor.
Okay, I see. Okay.
But that didn't really help her that much until
Only helped with it helped with the digestive system a little bit, but she wasn't doing any progress. And I started doing research to see if there's other specific way, like maybe there's other diets or something like that. And that happened that the other doctor we saw is actually in Marlboro, New Jersey. And then I guess BioNexus, when I did a search on the YouTube, on the internet, it just came up.
Okay.
In the area. And actually, I did reading. And I thought
we were more like looking who we can trust, something like that. We were doing something, but we were looking for someone with who could we work and we could trust, and somehow we trust you.
Thank you. It's quite an honor to hear you say that. Was it your first time with an autism specialist?
No, the first time we took Lena when she was about 2.5. We took her for the evaluation.
Right.
To the autism center in New York. And that's pretty much, but they wouldn't tell us much. They would just look at her and see what she's doing. And it was just like a more behavioral thing. They didn't tell us anything about diet or anything.
They just told us what kind of therapy does she need.
Right. Right. Yeah.
Nothing really.
I remember that with my son as well. Here's developmental delays, here's ABA, you have to do sensory OT, and yeah, I remember that. Yep.
Yeah.
So your first visit with BioNexus was pretty long. I remember that, I met Lena as well. And from there on, I also remember, she had behavioral issues. Was there aggression, right?
It wasn't aggression, but she would just climb things and she wouldn't listen. She would
jump from anything.
Yeah,
like
slam doors.
Fire is better.
Slam a wall?
No, doors.
Slam doors. Okay.
Yeah.
It was like behavior thing that all the doors were closed all the time in our house.
like we couldn't leave like any open door.
She was crying a lot for no reason. Like she wasn't able to tell us what's wrong. And it's been long time. So now like we kind of like forgot how it was, but we remember that she was crying a lot for like, we didn't know why she's crying. And overall, she was a happy child.
Okay, but she would have episodes of crying.
Like, just no reason. Crying.
Right.
Yeah.
Right.
I mean, probably there was a reason, but we didn't know.
Right, of course, yes. Yeah, which we did labs later on, and we realized just, she must be in so much distress with everything that was going on. She had the trouble sleeping, trouble self-regulating. You mentioned that, trouble going to the bathroom, eating. You had to do everything for her. Right. Academically, you had problems with like sitting down, focus, attention.
Yeah, there was very little speech, and she wasn't pay attention. She would do something for like 30 seconds and then run off because she wouldn't be able to sit at the desk.
Right. Right. Wasn't she using an iPad for communication at that time when I first met her? Right.
Probably.
Yes, she was using that. The application on the iPad just to tell you what she wants, and
right,
that was helping a little bit, but it wasn't really
we just realized, like, it's hard to remember when was that, but we realized she was using the iPad for about a year, maybe a little bit less.
Okay.
And we realized that she's able to really speak. She's able to tell us what she wants, what she needs. And that's how we stopped using the iPad.
Yes.
That was after she went on a protocol and started taking medicine, and
she was using her language more.
Yes, I remember. Yes. Hey, so can we start with that? I'm sorry, if you don't mind. Can you, so you came to the office for the first visit. We did a lot of testing. I also remember that your townhouse was undergoing repairs through your association for mold exposure, for like water damage and mold, etc. How did you react to everything that we found in her labs? Do you remember what I mean, she's been doing really well for a long time, but I wonder if you remember what we found in the labs.
Yeah, there was everything went off the scale.
Goodness,
I was shocked.
Yeah.
I was shocked because the numbers weren't even close to being arranged. A lot of numbers were really high off scale, which shocked me that, she must been going through a lot of inflammation in her body and stuff like that because of those numbers. And I really felt sorry for her, that she had to go through this.
Yes.
I just want to add that never before she was tested for Lyme, mold, and those kind of things. All the places we went, no one even did those tests.
No, they did basic blood tests, and then even with the diet, they just told us to just give her more beans and something like that.
Give her more beans. Okay.
Yeah.
Yes.
I don't know.
She was not going. She was not going to the bathroom for days, and so we were looking for help, but there was no one who could really help us. They put her on Miralax, which we didn't want to do. We did to help her a few times, but they told us she needs more fiber, right? So they recommend like what we should give her.
Right.
That's all.
Yes, Miralax is so toxic. It's, for children on the spectrum, but unfortunately it is widely prescribed that, if there's constipation,
And we knew that we can't help her this way.
Yes.
She was not eating right. So we knew that we have to do something would help her.
So with I do remember that we found, like Marcin said, the labs were off the charts, numbers were very high. So she obviously must have been going through a lot of discomfort with that inflammation in her body. So after we started the BioNexus herbal protocol, it's like step-by-step process. So Gosia, did you find it difficult, challenging? I know you had to do the SCD diet, right? The modified SCD diet, a specific carbohydrate diet, which is grain-free. And I remember it was really hard for you in the beginning, but then, once you started seeing the improvements. So can you walk us through that?
It was actually more my husband than me.
Okay.
It was tough. He learned more about like how to even start.
Okay.
And to start was really, really hard because she was crying. She wouldn't eat for days. And it was really,
she could eat, but pasta, bread, and
nowadays it's a lot easier because when we started, it was maybe 4-5 years ago.
4. It was 4, I think. Yeah, 2018, like late 2018 when you came to me, right?
Oh, he was the one who actually learned.
There wasn't so many options. Right now, you have lentil pasta, which is grain-free and gluten-free. That's you can just go and buy in the store. But
right.
like at that time it was really hard.
I think we had to do the research, like what's in there, what we can buy, what we have to like make for her. So he was the one who was cooking for Lena all the time.
That's awesome, Marcin.
You
So
learn
good.
now. Now it's
Yeah.
easy. It's easy. I think like maybe
Yeah, even our son, who's fine, he likes to eat.
he
stuff
likes her
like that.
food.
Okay, that makes it easier then, just to cook the same healthy stuff for both of them. Yeah, yeah. So what improvements did you see? Let's start with her gut.
We saw it right away. She wasn't, like complaining about food. She just sat down and ate everything that was on the plate. And then bowel movement every day, which wasn't happening in anything. Her belly wasn't bloated. When she was younger, her belly was just sticking out. It was bloated all the time. And in general, she was in better mood. She wasn't complaining about anything. She wasn't looking for her apple juice because we stopped giving her, this fake apple juice. She was drinking water, which was fine.
Only.
Basically, only water, which was, a great improvement, And she wasn't moody as she was before,
She wasn't as moody, yeah. So I guess her belly was feeling happy. Now she happily took all of the herbals. I believe we did a nasal test on her, nasal swab, and we found heavy infections. So I had given you a nasal spray. So all of the herbals and nasal spray she tolerated.
Yes.
Yeah, I mean, she has no problem.
At the beginning, she was maybe not happy with some of them.
Yeah, with the nasal spray, she wasn't happy in the beginning, but obviously it's not that fun. But she doesn't have a problem drinking any supplements.
That's
if
wonderful.
you tell her it's medicine, she's just she's okay with that. Like she takes anything we give her.
Okay, that is such a blessing, because she did a major turnaround, and somehow internally I've treated hundreds, perhaps even thousands of children around the world with autism, and one thing that I've learned, including at home with my son, was that they might not be able to communicate exactly what's going on, but they can feel that, oh, you know what, I'm taking this stuff every day and I'm feeling better. Something is feeling better, belly is better, the brain is better. I remember Brian telling me that he used to practice talking. In the beginning for Brian, it came out wrong, so he stopped. And then he would practice on his own. I would hear him in his room, blah, 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 blah. I couldn't understand what he was saying, but he was practicing. And then, so that's, they have so much self-awareness once they start getting better, I feel.
Yeah, the same with Lena. She's still, the pronunciation is on some words is still like off a little bit. You could tell, but she, at least if she really wants something, she's just gonna tell us. We don't have to think what she wants or assume what she wants. She just comes out and tells us. She's not very talkative like other kids her age, but at least she tells us what she wants, which is a huge improvement to us, because before she would just cry and go into tantrum, and
she was not even saying hi.
Nothing.
I see.
There was no words at all.
Right.
At one point.
And she started talking. So it started with one or two words, and then do you remember how her language came in pretty early?
Yeah.
She was talking, but then she stopped, and we had no words for such a long time. I would say maybe 2 years, 3.
Yeah. I think she just started maybe like really to say what she wants when she was like 4.5.
Mm-hmm.
But it was just after we changed the diet a little bit, not perfectly, but at least we didn't give her like goldfish or anything like that.
Yes.
Like toxic snacks and stuff like that. So then we realized that's the way, we got to go, because that's at least improving something.
Yes. You brought her to me when she was 4, approximately around 4, right? And 4.5, she started talking. I also remember that one incident that I think Marcin had mentioned it to me at one of our follow-ups, was that Lena will hold you by the hand and take you to the refrigerator if you forget the nasal spray.
Yes.
Yeah, that was her way of communicating, that she just grabbed the hand and pulled you whatever she wants to do.
It's like the routine.
Yes. Yeah. Good. How did you find her her behaviors? Behaviors improved?
Yes.
Yeah, because she at least listens right now, but before she would just try to do like crazy stuff, like jump off the second floor. We had a high ceiling, jump off the second floor on a couch, because that to her was fun. But we had to watch her all the time. We couldn't leave her alone for a little bit, because she would do something.
She couldn't sit. That was the problem. She was all the time like moving, doing something. Now she can sit, watch her iPad for a little bit, play.
She makes herself, sorry, you didn't have that before, right? Okay.
Yeah.
Okay.
Before, we definitely had, one of us had to be with her all the time.
Yeah.
Now,
yeah, we actively treated her for the first couple of years, and for the last couple of years she's mostly been on maintenance. And I said, now that I started the podcast, I was like, let me invite you, because what they say, girls, when they get autism, it's pretty severe, because it's so much more common in boys.
Yeah, and I think it takes longer time to recover, and for them to get better, because we have friends that also have a little girl on a spectrum, and she's really, really off, like screaming and stuff like that. So
right,
they're trying to do the same thing, but little improvements so far.
Maybe you need someone like you for help. It's
guidance.
It's very hard to do this on your own.
Yeah, it sure is. Yes. I hear that from many parents. The key seems to be customization. You run the labs, and then you have to customize it genetically to the individual child, because there's so many herbals out there, right? There are books and books on herbals, and it makes it quite challenging, especially when there are like neuropsychiatric symptoms, right? Behavior, anger, aggression, screaming. Yeah. So academically, right, with school, what improvements did you see in Lena? Alphabet, numbers, addition, writing, all of that.
She can write and read, not like books and everything else, but like in her class, when they give her a paper with sentences and tell her to write stuff, she can write, she can read the words. She's good in math. Basically, and
she's
computers.
Improving.
She's also in computers. She can turn on any computer there is.
Oh, of course, right? Modern kids, right?
To do.
Yeah, computers, devices.
All the time.
And of course,
small steps.
And of course, gym is her favorite, and she's awesome at gym.
Oh, right. See, I remember, one of the early on visits, you had mentioned that she got stronger, she got coordinated, she's eating better, right? So she became athletic.
Yeah, she's very strong for her age.
Yes. Oh, God bless. Yeah, that's fantastic. It's girl power. How does she manage with her younger brother?
Her younger brother is actually, like her babysitter, basically, but
she's very good with him.
She's very good with him. she
She's
listens.
too good.
Yeah, she listens.
She's doing
to him.
everything.
Everything for him. Oh, that's so cute.
And he takes her everywhere he goes. It's like, Lena, come with me. Lena will be 10 soon and he's 5. So he's afraid to go in dark, so Lena, come with me. And she never say no. She's a good sister.
Yeah. Okay. Well, so I guess, she's going to be 10. So yeah. So I guess I've known you guys longer than, I mean, we meet up and whatnot, right? Sorry, what was that?
I'm thinking like 5 years at least.
Yes.
Yeah.
Yes. Yeah. Exactly. You're right about that. Okay. So the mold situation has been resolved for you guys now. And so tell me, speaking of that, I mean, nothing related. I wanted to talk about language, actually. She understands Polish and English, and she speaks only English or both?
She doesn't really speak Polish.
She say words in
She
Polish.
says words in
Okay.
Like
Polish.
hi,
But sometimes she watches cartoons in Polish.
in
so
Polish.
just
He
that's
would
what,
even say more in Polish than
yeah,
English.
that's what she wants to do. She wants to watch it in Polish.
Interesting. Okay.
So we really don't know. She probably, and she understands everything in Polish. When we speak to her.
So she understands everything in Polish, but and then she watches cartoons in Polish, but she only speaks a few words. Okay, well, I guess she's mostly exposed to English in school, right? So
Yeah, I mean,
maybe it's the way it is. Like everyone speak English, so she's speaking English too.
yes.
And I think we speak English too to Lena, like mostly.
Okay.
yeah,
We just feel like, I don't know, she understands more, but she understands Polish very well. We know that. It's just
Right. Yeah, I started asking about mold was because right now I think the situation is fine with you guys, but in the middle, it wasn't. And then she's had a couple big exposures, re-exposures again. She's held on to all of the improvements with the re-exposures, but I remember Gosia mentioning something to do with an old building at one of the therapy centers.
yes. She was going for music therapy, and that was by the beach.
yeah, it was basically on the beach.
I see. Okay.
Very, very old building. They probably was water, damage at some point. But also in our townhouse, there was a stucco on this outside, which we didn't know. After they tested it, it came out to be infected with mold. And when they removed it, it was actually where Lena's room was like the most damage done to it.
Oh, goodness. Okay.
So
Yes. Stucco can be quite problematic with mold. Yeah.
So they replaced this stuff about, I don't know, maybe a year and a half or 2 years ago.
It will be 2 years soon.
So
And she stopped going for music therapy.
Okay. Good.
So we don't think she's exposed to mold anymore, or
Right.
maybe minimum, like a minimum exposure.
The problem is Lena loves to go on vacation. So we try to go as often as we can, and there's always a chance that she might be exposed there too.
Yeah.
Yes, there is. Yeah, certainly. We have to plan still. For my family, we have to plan vacations quite carefully, around my son's needs. So, but we go. I mean, I usually take air purifier with me everywhere I go, so that helps quite a bit. And we also take all of his herbals. I mean, he's also on a maintenance now. I mean, he's more than 18 years old now. But he's on a maintenance protocol still. It's better to be cautious, it's all natural.
Oh yeah, we take her medication
Always.
with us all the time when we come. Yeah.
Have you traveled back to Poland with her?
Oh, many times.
Yeah, we
Oh,
go
right.
every
Okay,
year.
many times. Okay.
Yeah, she loves traveling. That's one thing. When we just say we're going to the airport, she brings bags and starts packing and
Oh, goodness. Wow. She
Sometimes
starts
she's ready
packing.
when we're not
Yeah.
ready.
Oh,
Sometimes when she wants vacation and we're not going anywhere, she'll just come up and say, let's go on vacation. And without even waiting for me to say anything, she brings the bags. It depends on the season. For wintertime, she brings all the snowsuits and everything.
Summer, we have swimsuits. Yeah.
she says, let's go on vacation. I love it.
She loves to be away.
Yeah.
Yeah.
Oh, goodness. What a cutie pie. Okay. Okay, cool. You know, in order towards the end, we are almost at the end. What I wanted to request was if you guys can sort of, summarize for us in Polish. If you can speak about some of the symptoms before doing the BioNexus herbal protocol, and then the improvements that you've seen after that, and what would you like to tell the parents out there, because I'm sure most parents who have daughters diagnosed with autism spectrum disorder, they are also told the same thing, that with girls it is more severe than with the boys. And so, is there something you could say to give them hope?
Tak. Chcielibyśmy tylko powiedzieć w sumie, że warto szukać po pomoc i szukać rozwiązania. Lena była 4-letnią dziewczynką, która jadła bardzo niezdrowo, miała problemy z wypróżnianiem się przez dni, nawet do 10 dni. Kiedy znaleźliśmy doktor Dashore, wszystko się zmieniło w przeciągu kilku miesięcy. Lena jest szczęśliwym dzieckiem, potrafi się bawić, potrafi siedzieć, nie biega ciągle w kółko. Jest szczęśliwa, bo może się wypróżniać codziennie, je bardzo zdrowo, je wszystko, co ma w sumie na talerzu. I myślę, że dla nas to był bardzo dobry początek, uzyskać pomoc dr Dashore. Dała nam wskazówkę, co po prostu mamy robić i w którą stronę iść.
I druga sprawa jest też, że nie można się poddawać, że dziecko nie chce czegoś robić przez tydzień czy przez 2, to nie można po prostu zrezygnować, usiąść i siedzieć i czekać, że stanie się cud, bo tak naprawdę z tymi dziećmi trzeba pracować, nie można po prostu tylko sobie liczyć na cud. Trzeba wprowadzać dietę, trzeba wprowadzać medycynę. Najlepiej medycynę, tak właśnie jak proponuje dr Dashore, że nie żadne tam, według mnie przynajmniej, nie żadne farmaceutyczne, tylko bardziej herbal, czyli
po prostu, żeby nie zaszkodzić im też.
Naturalne metody, czyli zioła, moim zdaniem takie ziołowa medycyna działa najlepiej.
My jesteśmy bardzo zadowoleni z efektów. Lena stała się zupełnie innym dzieckiem, szczęśliwym dzieckiem przede wszystkim. Chyba to wszystko.
That was it.
So yes, well, I did not understand 95% of that. but thank you for that. That's awesome. Now let me see. I know 3 words in Polish, and I can speak 3, and I can understand a bit more. So I know, let's see, I know dzień dobry, and I know jak się masz. Am I saying it correctly?
Yes.
Yes.
And then, after this wonderful summary in Polish, I should probably say dziękuję.
Yeah, no problem. Nie ma sprawy.
Nie ma strava?
Yeah, that's no problem, basically.
Okay. Okay, nie ma strava. Okay, well, see, that's something. I love languages. I used to be able to speak many, but then, I lost practice.
Yeah, that's awesome. I mean, it's hard to speak too.
Mm.
We speak only Polish and a little bit English.
You speak both wonderfully. I mean, English is absolutely perfect. And one thing I have to tell you, you guys have been so modest with your with your podcast today. But then, I have to let everyone know that you have done everything from cleaning the environment to cleaning up her diet to air purifiers to joining organic co-ops and making sure you get home delivery of fresh organic produce. Like everything you've done, far above and beyond to help Lena.
I just want to add, we just got a top-loaded washing machine too.
Awesome. Okay, love it. Okay, good. So now watch my washing machine video podcast to see how to take care of that top loader.
Yep.
Yeah, I mean, front loading is the one that I've shown in the podcast, but top loading needs that monthly maintenance as well.
All right. Yep. We'll watch it.
Okay, great. Well, thank you so very much for today. I really appreciate. So in English, what would you say to the parents of other little girls diagnosed on the spectrum? What would you, and any words of inspiration that you may have for them?
I think just stay focused, don't give up. It takes more time. It's not going to happen overnight. You just got to stick with the diet, stick with the protocol, and, just believe in it and be patient, and it's going to happen because it happened to us. I don't see why it wouldn't happen to anybody else.
I'm glad everyone is doing well. Thanks again.
Thank you for having us.
All right, everyone. So that brings us to the end of this episode of Autism Uprooted. I hope you found it inspiring and helpful, educational as well. So I look forward to seeing you in the next episode. Until then, be well. Namaste.
Thank you for joining Master Herbalist Dr. Jodie A. Dashore, Director of the BioNexus Health Clinic and BioNexus Herbals, on the BioNexus Health Podcast, where we explore and share information and stories about recovering and healing from chronic and environmental illnesses such as mold biotoxin illness, Lyme disease, autism spectrum disorder, fatigue, Crohn's and colitis, mast cell activation syndrome, PANS, and more. Please help us grow our message by subscribing to our podcast channel and sharing the podcast on your social networks. For more information, visit bionexushealth.com.
Information within this video, audio, or text, collectively known as the podcast, has not been reviewed by the FDA. Nothing within the podcast is intended as or should be construed as medical advice. Information is for general informational and educational purposes only. Consumers of the podcast should consult with their healthcare practitioners for medical recommendations. Seek the advice of a qualified healthcare provider. Do not disregard the advice of a healthcare provider based on any information from the podcast. The information within the podcast may contain information concerning dietary supplements or over-the-counter products that are not drugs. Our dietary supplement products are not intended for use as a means to cure, treat, prevent, diagnose, or mitigate any disease or other medical or abnormal condition.